News that broke this week has put a spotlight on an extremely rare occurrence. A patient from Michigan died in January at a hospital in Ohio after receiving a kidney transplant. The Michigan Department of Health and Human Services confirmed the death and shared a statement saying a public health investigation determined they contracted rabies through the transplanted organ. The transplant was conducted at a hospital in Ohio in December. The Michigan Department of Health and Human Services worked closely with the Ohio Department of Health and the Centers for Disease Control and Prevention on the investigation. Now, the statement also said the donor was not from Michigan or Ohio. This has raised questions about the donor screening process. We talked with the director of the Transplant Infectious Disease Center for University of Michigan about that. He said there are countless diseases like rabies they don't test for because they're so rare, but any surgery comes with inherent risk.
People who have organ failure and need transplants shouldn't be discouraged or scared because of cases like this, because the risk of not getting a transplant if you have organ failure is so much higher that a bad outcome will occur than this kind of incredibly rare but tragic situation.
A test for rabies would take days to get results, while donated organs are only viable for a matter of hours.